Good day, everyone. Let me use this opportunity to welcome us again to this class session. I am Mr. Oyedimo Joshua by name, and I will be our resource person who will be taking us through this course in a 204 titled Anatomy of Thorax, Abdomen, Pelvis, and Perinium. So, before we proceed, it is always good by the way of introduction that we know the overview of the course or the class session we are about to take. So this class session is divided into 30 weeks of teaching, and this is how it will be done via online module teaching like this. And also, as this class session is going to be an introductory class, and I will want us to drop any question we have as the class is going on into the comment section. If there is anything you want to ask, and also I want to encourage us to regularly check our Moodle profile and our portal to get information as there is need be. So without any further ado, let's delve into today's class session. So these are the course contents we'll be looking at in today's class, which are introduction to the trunk, which cover the thoracic, abdominal, and the pelvic regions, thoracic cage structure, bones, muscles, and intercostal space, pleural cavities, lungs, and the mediastinum, which include the anterior, superior, middle, and the posterior. So we also have the heart anatomy, pericardium, and major vessels, applied anatomy of the heart, muscles, blood supply, and innervation of the anterior abdominal wall, inguinal canal, hernias, which include the inguinal and femoral, and the peritoneal cavity. So we also have the abdominal, esophagus, stomach, duodenum, small intestine, large intestine, liver, and bladder. So also the portal venous system and portocaval anastomosis. Pancreas, biliary apparatus, liver, gallbladder, kidneys, suprarenal gland, ureters, diaphragm, and posterior abdominal wall. Pelvic diaphragm, which include the male and female reproductive organs. We'll also be looking at the major arteries, veins, and lymphatics of the thorax, abdomen, pelvis, and perineum, and also the male and female external genitalia, perineal pouches, and original diaphragm. So within the context of this course content, we are expected that at the end of this class, we should be able to identify the bones and the bony markings of the thorax, abdomen, pelvis, and perineum. List the nine regions and the four quadrants of the abdomen and the principal structure within them. Describe the musculature, blood supply, innervation of the anterior abdominal wall. Recognize the arteries, veins, and lymphatics of the thorax, abdomen, pelvis, and perineum. List the main branches of the aorta and describe the disposition of veins in the abdomen. Explain the path, position, and surface markings of the stomach, duodenum, physical spleen, liver, and gallbladder. Understand the anatomy and significance of the greater and lesser omerta, and describe the surface anatomy of the jejunum, ileum, and section of the colon. Describe the anatomy of the pelvic diaphragm, its attachment and structure passing through it. Explain the anatomy and clinical significance of the ischio-anal fossa. Understand the anatomy and relations of the ovary, uterine tubes, uterus, cervix, and vagina. Recognize the neurovascular supply of the clitoris, vulva, vagina, and perineal structural. So also have the describe also, and not the least rather, pardon me for that. Describe the origin, cause, and clinical relevance of the duodenal nerve and its lymphatic drainage. So let's really delve into the introduction into this class session, and we'll be looking at the trunk anatomy, which consists of the thorax, abdomen, pelvis, and the perineum. So in this class session, this trunk, it majorly talks, or it consists of the major part of the body that house all these major organs in the body, which include the thoracic region, the abdomen, the pelvis, and the perineum. So it contains the vital organs for respiration, digestion, circulation, and reproduction. So this trunk anatomy, which is essential for understanding body support and potential mechanism, is what we will be looking at in this course. So also in this class, we'll be looking at the bony anatomy of the thorax, abdomen, pelvis, and the perineum. And at the thorax, these are the bones located at the thorax, which include the ribs, sternum, and the thoracic vertebrae. I hope you can see the diagram representation of what I'm talking about. So here, this is the thorax, and this is the abdomen, and this is the the pelvis and the perineum located here. So uh, these are the regions and the quadrants of the abdomen. So we have the liver, gallbladder, and the right kidney, which are located in the right upper quadrant. We also have the left upper quadrant, and this in this particular region we have the stomach, spleen, and left kidney. We are located there. So, and at the right lower quadrant, we have the appendicecum and the right ovary. So, and at the left lower quadrant, we have the sigmoid, colon, and the left ovary located in that region. So, these are the 9 regions uh, around the abdomen. So we have the right hypochondriac, epigastric, left hypochondriac, we have the right lumbar umbilical, left lumbar, right iliac, hypogastric, and the left iliac. So let's look at the thoracic cage and content. What we'll be looking at here, which include the thoracic cage, the intercostal spaces, the pleural cavities, and the mediastinum. So I hope you can see a diagram representation of that. So this is the thoracic cage here, which is the bony structure which consists of the ribs, sternum, and the vertebra, right? So, and in this particular region, there are organs that are located there, and what this bones do is that it helps to shade these organs from external injuries. So, we also have the intercostal spaces too. So, the intercostal space is the space in between these ribs that you can see here. So, without wasting our time, let's also look at the anatomy of the heart. So, heart it consists of 4 major chambers in which we have the right and the left atria, we have the right and the left ventricles, right? Also, let's talk about the pericardium, which is the fibrous and serous layers surrounding the heart. So we have vessels that supply blood into the different part chambers of the heart. So we have the superior and inferior vena, we have the cava, we have the aorta, we have the pulmonary arteries and the veins. So the application in disease such as pericarditis, heart failure, and coronary artery disease. The clinical anatomy has helped to bridge the gap in providing knowledge in solving and treating these diseases and problems we have in this area, right? So let's also look at the abdominal wall and inguinal canal, so which include the anterior abdominal wall, blood supply, inguinal canal, and the anus. This is a diagram representation of that here. Also, we'll also be looking at the abdominal viscera, that is every organs that are located in the abdomen, in which we have the stomach, the duodenum, we have the liver, we have the gallbladder, we have the pancreas, we also have the portal venous system. And the stomach, we'll be looking at the anatomy, the blood supply, and the surface markings. And in the duodenum, we'll be looking at the 4 parts, which include its relation to the pancreas. So, and the pancreas, which does the exocrine and the endocrine functions and its anatomical position, we're also looking at that. So, and the liver, we'll be looking at the structure, lobes, and surface markings of the liver too. Why the portal venous system, looking at the portal vein, the portal hypertension, and the port cava anastomosis. So, we'll also be looking at the pelvic diaphragm and the perineum, in which the perineum is divided into the urogenital triangle and the anal triangle. I hope you can see a diagram representation of that here. So we'll also be looking at the pelvic floor muscles, in which we're talking about the importance in supporting pelvic organs and control of continence. So yeah, let's quickly also brush through the male reproductive organs. If you have any questions as this class going on, I'm expecting us to drop any question we have in mind in the comment section, and it will be addressed. So the male reproductive organs, which consist of the testes, epididymis, vas deferens, the prostate, and the external genitalia, and all this works together in the process we call the reproduction. So the testes, what the testes does is that it helps in the sperm production and the testosterone secretion, and while the epididymis helps in the sperm maturation and the storage of the sperm, right? So the first difference is just the pathway for sperm during the ejaculation, while the prostate, which is the gland producing seminal, the seminal fluid, while the external genitalia, such as you have the penis and the scrotum, and two testes inside the crostrum, right? So let's also talk about the female reproductive organs. We have the ovaries, we have the uterus, we have the vagina, we have the fallopian tubes, and the external genitalia. So the ovaries is just the site of egg production and hormone secretion. So the uterus, which is the layers, and which is also uh, the the house that helps to uh, house the embryo. So at the vagina, which will also be looking at the structure and the neurovascular supply. So, and the fallopian tubes too, which is the pathway for the egg to reach the uterus. So these are the major blood vessels and the artery that help to supply blood to the what? To the abdomen and also the different part of the body. So you have the celiac trunk, superior mesenteric artery, and the inferior mesenteric artery, which supply blood to the different abdominal branches. So let's also look at the nerve supply of the thorax and the abdomen, in which you have the lumbosacral plexus, which supplies the lower limb and the pelvic region. You have the pudendal nerve, this supplies the sensation of the external genitalia and perineum. You also have the nerve blocks, and we'll be looking at the importance in clinical procedures such as the pudendal nerve. So in conclusion, I hope you agree with me that the anatomy of the thorax, abdomen, pelvis, and the perineum is very crucial for understanding the structural and functional relationship in the human body. So the knowledge of this area is essential for both clinical applications and medical practice, from diagnosis to surgical procedures. Thanks for staying with me to the end of the class. So we shall see next class.